Okay, so there's 5 key points I'm going to pick up. I'm not going to run through these now even because Steve's picked up on most of this already. It really seamlessly hands over for me to give some examples. The bits I will pick out is that, so the team I'm in DH, we're really keen to work with NHS and local government partners around the country to look at applying these approaches. So I'll talk through some of the work we've done. I'm going to give I think 6 project examples, and 4 of them are ones that my team in the department has done. But you can see just by the detail, these have all been in partnership with others, NHS bodies, charities, local authorities. So keep that in mind, and then catch me at lunchtime if you think this is something we could discuss. We're really keen to do that. I'm going to finish, so I'm going to give those few examples, and then I'm going to finish with a game, and I'm going to set up the game now. So this is to think about this challenge, and it actually builds on an example Steve's already given, and then I'm going to come back to it in about 15 minutes. Okay, and the challenge is organ donation, so one of those very behavioural challenges that Steve mentioned, and I want you to imagine that it's your job to increase organ donation rates. And these are the facts you're faced with. So almost everyone would be happy to donate their organs after they die. So in surveys of the English population, 9 out of 10 people say after they die they would be happy for their organs to be used. So people want to do it. So how do you go about expressing those wishes? Well, in England you would sign up to the organ donor register or carry a donor card, and there's very high awareness of that. I mean, maybe, let's have a show. We've done lots of shows of hands already, haven't we? Show of hands for anyone who's got an organ donor card. That's a good number. That's probably above average. It's really easy to do. You might have signed up through Boots, through your GP surgery, and I've timed myself doing it from typing it into Google to having joined is about 30 seconds. So it's really easy to do. Yeah, the problem is, in England as a whole, only around 1 in 3 of us has joined the organ donor register. So if that's your job, remember, so what would you do about this if that's your job to increase organ donation rates? Well, you could try to persuade more people that it's a good thing. But actually people are quite persuaded already. We're already 9 out of 10 people are happy to do it. You could raise awareness of how you go about expressing those wishes, you know, a comms campaign. But again, there's already very high awareness about organ donor cards and the register. Or you can make the process easier. You know, often processes are not very straightforward, but in this case it is, so that's not going to solve your problem either. So this is a challenge that I'm going to come back to at the end. Have a think through some of the things you could do to increase organ donation rates. And I'm going to rule something out, and that's you can't change the law. As Steve said, ministers in England don't want to make it the default. So Steve gave it as an example as if you flip the default and you have to opt out, that's true, there's very strong evidence that would increase organ donation rates, but you can't do that because ministers in this country don't want to. So keep that at the back of your mind, and I'm going to now go through some examples of some projects we've done in DH with partners and a couple of other health examples, then the game, then I'm done. So the first project, I should say, I've just sat at the back, I was a bit late arriving. I know the detail at the back you won't be able to see. I don't think in most cases the detail really matters, but I'll pick out the key points. This example, again, Steve has already spoken about this a bit. How could you go about reducing missed hospital appointments, DNAs? And he spoke about a great study that he did in GP surgeries with that commitment over the counter. When we set up the team in DH 2 years ago, we also thought, well, could we look at other ways that you could reduce DNA rates? But without introducing anything new. So that quick conversation over the counter is very effective, but we thought, well, what could you do without even that very quick discussion? So what we looked at was optimizing the content of a text message reminder. So most hospitals and primary care, maybe the organisations you work in, send reminder messages by text. Sometimes they're phone, but that's a bit more costly, so they're ordinarily by text. We know they work. There's actually a systematic review that showed this works, but no one had ever looked at what the content of the message should be. And I think Steve set this up really well. That detail really matters. So we tested with Bart's Hospital. We ran it in 2 parts, but a randomized control trial, so gold standard evaluation with 20,000 patients, and they were randomly assigned one of 7 different reminder messages. So any patient who was coming to an appointment anyway, we wanted to see, well, does this matter? And we sent them a bunch of different messages, and then we measured, did that make any difference on their attendance rate. And what I've done here is I've just put up just two of those, the standard message at Bart's, the one that they're already using, and then the best of those that we tested. So the standard message, it is fairly standard, appointment at location, date and time, and then to cancel or rearrange, call the number on your appointment letter. It's fairly standard. One of the other variants we tested, which wasn't as effective as the best one, just put in that number. So to cancel or rearrange, call X. It just made it a little bit easier for people, and that helped a little bit. But the best, which includes that component as well, so similar beginning, and then it says not attending costs NHS £160 approximately, and that is actually the average tariff cost for the clinics where we ran the trial. And it's to provide that reciprocity, which we mentioned earlier, that feeling that people care about the NHS. So here's what you can do to do your bit to protect NHS money. This isn't about fining a patient. It's not saying you pay £160. It wastes that to the NHS. And you can see from the graph on the right, that made a really significant difference to DNA rate. It took it down from 11.1% to 8.4%, so now way below the national average. That's massive productivity saving. And if you think through what that trust has to do to roll that out, which they have since done, as have a few others, it's just changing a couple of words in a text message. So you don't need to train staff, you don't need to introduce any new process, you're not penalising patients. All of those benefits spoken of earlier, you just type in a few words in a text message. Of course, we didn't know what the words were, which is why we had to test a whole bunch of different variants. We didn't have something off the shelf. Mindspace and frameworks like that provide ideas of approaches that might work, but the context is really important. And for example, in this context, a social norms message didn't make any significant difference, but we wouldn't have known that unless we tested it. But the test was really simple. And this is a sort of discussion that if you were interested in running experiments like this in your organisation, my team in DH or external organisations like Steve's and others, we're quite experienced in these sorts of things, and they needn't be too complicated, they needn't take too long, they needn't be costly, and you can get that sort of benefit. In the meantime, Bart's now used this message, as does King's in South London, and they've both recorded their lowest ever DNA rate, just for changing a couple of words. So I'm going to go for another couple of examples, but I'll skim through them a bit more quickly because I think you might get the idea with some of this now, some of the methodology. But just a few more examples to bring it to life. This is, again, detailed, don't worry, at the back. Basically, this is an invitation letter to patients to book to attend their NHS health check, which is a sort of midlife lifestyle check, midlife MOT. And it's commissioned by local authorities, but ordinarily, you attend a health check at your GP surgery, and the letter inviting you comes from the GP. The letter on the left, again, if you don't worry about the detail, you can see it's not a terrible letter, actually. I've found many worse patient-facing communications, but it fills up a full page. It's not, immediately clear what you've got to do if you read it. We've tested a whole bunch of variants against this. I've just picked one. Again, without looking at the detail, you can see it's much, much shorter. Much, much shorter. The language is a bit more direct. So rather than please book an appointment, it's you are due your health check. And it incorporates at the bottom, the blue section, a type of commitment device. That was C in Mindspace, C for commitment. And this is that the patient records the details of their own appointment. So it's a little bit of a memory aid, but it's also that you're promising to attend. And that was a 4 percentage point increase in attendance, but relatively that's bigger. That's about 13% relative improvement just by changing a letter. And again, it's entirely cost-free. If you're sending that letter, you might as well change it to that one. No training, no complex system changes. Since then, we've actually bettered it. With a slight tweak, we've increased the effectiveness somewhere else, but I think this makes the point. Again, this is already being rolled out across the NHS. There's a lot of detail here. Right, so I'm going to stand over here for a minute in front of the slides. This is the DrinkAware website. So DrinkAware is a alcohol harm charity, and they provide lots of information to patients or anyone who might have concerns about their drinking. Ordinarily, the way they encourage people to take action is a fairly traditional health message. So the top, this is just a screenshot of the web page. So cutting down on alcohol reduces your risk of irritable bowel syndrome, breast and bowel cancer, and liver disease. A fairly typical sort of health message. And we contrasted that against a message framed in a different way. So coming back to message framing, what appeals to people, what attracts their attention. And we tried a different message, a bit more unusual for the NHS or any sort of health campaign. And it says, like, is alcohol affecting your appearance? So cutting down on alcohol can reduce your risks of saggy skin, obesity, premature aging. So this is all true, all of this is factual, but we contrasted that against that. And for women, so few people who look at the website do anything, they're just browsing the internet, right? But there is an outcome measure, I won't go into details, but it's a behavioural outcome measure. For women, it was 15% more women were likely to do this sort of self-check with the appearance message than the more traditional health harms message. So again, a very significant difference just by changing a few words on a website. Interesting nuance, for men there was no difference. Now I don't think that's because men don't care about their appearance. I think it's because they care about it in a different way. So if it was about, I don't know, maybe it was being less fit and things like that, maybe it would work differently. But this was deliberately tailored to women because that's what the health charity wanted to do. This is a bit of a grim example. This isn't actually a trial. It was an opportunity for a natural experiment when the law changed around packaging for paracetamol. So this is to tackle suicide by paracetamol, so it's a bit grim. But in, when was it? 1998, the government changed the law. So this was a forceful nudge. This required legislation. And what it did, it reduced the maximum size of the packaging for paracetamol. So if you bought them in a regular shop, you could only get them in packets of 16, in a pharmacy up to 32. And what that was trying to do is just make it a bit more of a faff, a bit more inconvenient if someone's in that moment and then they may make that terrible decision. It doesn't actually stop you going to 2 different shops to stock up or anything. It just makes the process more difficult. So Steve said one of the key concepts of behavioural science is just make things easy for people if you want them to do something. If you don't want them to do something, make it a bit more difficult, a bit of faff. And there was a really significant difference in suicide by paracetamol following that simple change. So that did require legislation, but there may be instances when if you want someone to do something, make it easy. If you don't want someone to do something, just add a bit of a sort of hassle factor. It's not a pretty slide, this one, but so those are examples of nudges appealing to patients and the public, but you can also influence professionals. And this was a study, we're doing a whole bunch of studies with this academic in Nottingham. And what it does is, it was in a trial so hospital doctors, there may be some medics here, I'm going to really sort of gloss over the clinical aspect here, but hospital doctors who day in, day out would order a common blood test. It's a test for inflammation, and they may go down the ward and order the test frequently all day. And it's a really cheap test, it only costs £1. But this trial, what it did at the time when the doctor was deciding whether to use that test, they were reminded of the cost of the test. So it was either on a paper form, when it may have been something not dissimilar to just a post-it saying this costs £1, or in an electronic prescribing form, which some hospitals have now. You just put in an additional column of the costs. And the costs are already known, they're in the formulary. You can find out the costs of common tests and any equipment and medication. But it was about the timing. So it's at the point when they might do something very habitually, try and break that habit with a bit of information. And just by providing that cost feedback, it reduced use of the test by 1/3. And if you think through a couple of things we didn't do there, we didn't control their clinical choice. You weren't restricting clinical freedom. We weren't even persuading doctors. You weren't saying, please use fewer tests. It may be a waste of money. You were simply providing timely and simple information, in this case about the cost. And we're replicating this in a few other studies because we think that this approach is really simple. It's already used a bit in the NHS, but it's not really evaluated very well. We think it could actually have big impacts on cost savings, very quick, real cash savings. This was set up brilliantly earlier. So this is about the timing issue. You know the analogy about if you're giving evidence in court, you would say it first, I promise to tell the truth, and then you give your evidence. Well, I'm going to stand in front of the slides again here. So this is the back of the FP10 form, the prescription form, and this is so patients who may be exempt from charges they would declare their exemption category. They may not need to pay for their prescription because they're under 16. So they would tick the box and then sign it. And frankly, the rules are really confusing as well, so it may take a bit of time to look at. Exactly as was said earlier, that's the wrong way round. So from this year, the prescription form is going to change, and now you sign to say you'll declare honestly whether you're exempt, and then you will say why, rather than the other way round. You're very unlikely, if you did, let's say you're a little bit dishonest, just as the example before, most people a little bit dishonest, potentially. If you did tick it a bit recklessly, you know, you're not sure if you've got this particular HC2 charge certificate or whatever, the rules are complicated. And then you sign, you're unlikely to go back and get the Tipex out and correct it, aren't you? That's just not the way people are. So this is just designed to go with how people actually are first and sign it. We won't know if it makes a difference. We can't actually run that as a trial, but it's seen there's enough, maybe this is a good example of sometimes there's enough evidence from existing behavioural science that we can just have confidence and go with a useful innovation. And my final example, this is another trial looking at doctors' behaviour, but here it's about patient safety. And are there any doctors in the room before I say you've all got terrible handwriting, really, really terrible? This is to tackle that problem, and it's just to go with it. So people are busy, they scribble things down in, you know, terrible handwriting. Don't fight that, just try and design tools to help people present information more clearly. So there is no standard prescription form in hospitals in England. So this was just a trial at one hospital, St Mary's in West London. And it redesigned the prescription form to make it easier to eliminate that sort of messy handwriting and error. So for example, if you're writing it out, the difference between micrograms or milligrams in an abbreviation may be fairly easy to mix up. So instead of printing it, you circle it, things like that, and boxes to print letters in. It's really straightforward. And you can see from the graph, again, don't worry about the detail, massive differences in, for example, the frequency of medications entered correctly, just by redesigning a form in a tiny little way. I think that's it. So I'm done with examples. I do have, now we've got a few minutes for a game, and this is now to test your, after a morning, to test your understanding of behavioural science. I'm going to tell you, we did two things here. I'm going to tell you the first one, what we did to increase organ donor registrations, and the second one we're going to play that as a game. So the first thing we did, so why don't people just don't get round to joining the organ donor register? And the government doesn't want to switch that default. It doesn't want to automatically enrol you. So what we did, this was a trial between the Department of Health and the Behavioural Insights team at the Cabinet Office. I think they may have been mentioned earlier. When you're doing something completely different, in this case when you're renewing your car tax online, or when you're getting a driving licence, so nothing to do with organ donation at all, you're prompted. So it's a prompted choice in the jargon. So you never get round to it. So let's just prompt someone when they're doing something else. And that's free because the government owns these websites. So most people renew their car tax online. So that's 40 million people every year potentially going to their car tax website. So at the end of that transaction, it's still there in fact, you'll just be prompted. And you can just say, yes, I'll join, or I think it's yes, join, or more information, or you can just shut down the web page. And that on its own has made a massive difference. I think that's now the third highest source of donor registrations in the country after GP surgeries and some of the more traditional approaches. So fantastic and almost no cost. This is the game though. So I'm going to show you web shots of the screen. So this is the final screen on the car tax payment page. As well as that prompt, so this is that simple prompt, we had a great opportunity to test, well, does an accompanying message boost this any further? And this is where we got to draw on all of those, the mind-space framework and behavioural science, to see, could you enhance this and further increase organ donor registrations? The answer is yes, and what I'm going to do is show you 8 different versions. So I'm going to go through these 1 to 8 really slowly. I'll read them out for those at the back in case you can't see the text. And then I'll go back to the beginning and you put your hand up for which one you think was most effective, and I'll tell you at the end. The difference, there was a substantial difference. So between the worst and the best, it was about a third improvement, which equates to about an additional 100,000 organ donor registrations per year. So that's not to be sniffed at. Okay, so I'm going to show you 1 to 8. This is number 1, which is just the standard page. Thank you. Please join the organ donor register. So that's number 1, keep that in mind. Number 2, has a social norms message. Every day, thousands of people who see this page decide to register. So number 2, social norms. Number 3 has that same social norms message, but also has a picture of a bunch of people like you. You know, that's simple. Social norms with a picture of people like you. And number 4, this is the last one with that social norms message, but it has more of an authority logo. So this is the NHS organisation that runs organ donation. So showing you a bit of an authority figure from the NHS who wants to encourage you to join the organ donor register. That's number 4. Number 5 is a loss framed message. So 3 people die every day because there are not enough organ donors. And then contrast that against a gain framed message. You could save or transform up to 9 lives as an organ donor. That's number 6. 2 more. Number 7 is a reciprocity message. So if you needed an organ transplant, would you have one? If so, please help others. And the final one, version 8, is that sort of intention into actions gap. You know, you do intend to do something, you don't get round to it. If you support organ donation, please turn your support into action. Okay, so that's the final one, number 8. So I'm going to go back. There we go, right. And I want to show our hands on each one. So number 1, who thought this was the most effective? Okay, excellent, good, okay. Number 2, social norms message. Okay, 1, okay, a bit of peer pressure, 2, a couple of people, not many. Bit of peer pressure here, you're hanging on. But, number 3, social norms with a bunch of people. Wow, okay, really popular. Okay. And number 4, social norms with that NHS logo. Okay, 2 or 3. Number 5, the loss framed message. Okay, popular. And again, the gain framed message, number 6. Some. The number 7, the reciprocity message. Some. And then the final one was the intention into actions. So the most popular one, this is brilliant. The most popular one was the social norms with the picture. And then I think that looking around the room, the loss framed and then the reciprocity ones were next, I think. The social norms with the picture was worse than nothing. So the control, the small numbers, most people just get their car tax. They might already be on the register or they may not want to join. But it was worse than having no message. So well done, everyone. We have actually tested this with some of the leading behavioural scientists in the world, including the guys who wrote the book Nudge, and they got it wrong as well, so don't worry. The best one was that reciprocity message, you know, that would you take an organ? And again, it's that sense of give and take that's really powerful. Closely followed by the loss framed message, and Steve definitely gave you the answer to that earlier. Loss framed is much more powerful than gain framed. And the others weren't statistically different. But I think that shows context is really important. So we didn't put that social norms message with a picture in it so I could get a sort of laugh at a conference. We did genuinely think it would be better and it would be worth testing. We only tested things that the science suggested would increase organ donation rates. And we wouldn't have known it unless we tested it. We could have inadvertently been reducing donation rates. So there's a really powerful lesson for us there around the importance of experimentation and of context. Because it doesn't mean that social norm messages don't work, it just means they don't work in this particular context. So sometimes you can learn things from the frameworks, other times that context is really important and it's worth testing. I think I'm done now. I'll skip that just to say there is lots of reading. There's a copy of this book is here, someone's put, maybe already mentioned it. Steve spoke to the Mindspace framework, which is great. There are others, but they cover the same sort of territory. So I wouldn't say read more than one. The Mindspace one's, you know, really grounded in good evidence. And that was just the key points again. I'll be around for lunch and then a little bit of the afternoon. As I say, me and my team in the Department of Health and a team in Public Health England and hopefully soon a team at NHS England and lots of academics and places like the Health Foundation are really getting into this now. We are starting to apply these approaches and we're really keen to work with people, you know, on the ground delivering services. So do get in touch if you want some advice or perhaps a collaboration to run a project. And that's it, I'll stop there. Thanks.